Hi, everybody. We are here today with me, Maria Yakimchuk from Parent on Board Coaching, and with Dr. Ksenia Gershberg, Doctor of Chiropractic from Empowered Mama Chiropractic. And we have prepared a special presentation for you, mamas, in the fourth trimester so that we can help you heal postpartum and feel the best that you can in your motherhood. So welcome.
Welcome, everyone.
All right, yeah, welcome, moms. We've got something exciting for you. So this is a little bit about us. So my name is Maria, and I am the owner and the coach at Parent on Board Coaching. I'm a certified transformational EFT coach. And for those who don't know what EFT is, it stands for Emotional Freedom Technique or tapping. And I work with moms who are looking for a medication-free way to heal their postpartum depression and postpartum anxiety. I'm a mom of two boys, and I love helping women break cycles of trauma and discovering their authentic, powerful selves.
Hi, I am Dr. Ksenia. I'm founder of Empowered Mama Chiropractic. I'm a certified prenatal and pediatric chiropractor, mom of two kids, and that's why I'm super passionate about helping moms through bridging the gap from pregnancy to postpartum. And I have two pups. I am also certified in applied clinical nutrition and applying it to postpartum and helping moms really thrive through their motherhood journey.
All right, so this is a little bit of a factoid for women and to explain why I got into doing what I've been doing, because what I'm seeing and something that I have experienced, I'm part of the 20% of women who have had a perinatal mood and anxiety disorder. I had both postpartum depression and postpartum anxiety. And just like many of those 20%, I didn't receive any help. I didn't get diagnosis. I sort of struggled through it on my own. And I wasn't thriving, just like a lot of moms aren't. And because of that, because I know what this feels like, I really wanted to create a space where moms don't feel alone and feel understood, and they're not stigmatized for their hardships, and can receive loving care and support in order to heal and have a successful life transition into motherhood. And that is what I provide with the mental health support, and Dr. Ksenia provides with the functional nutrition and functional medicine support, because we really need to look at postpartum care as integrative care. It's not just one thing. So here's some postpartum struggles that are common to a lot of moms: exhaustion, guilt, feeling like a failure in motherhood. Reality of motherhood doesn't meet your expectations, because a lot of us are brought up viewing motherhood a particular way, having this sort of fairy tale, and the reality never measures up to that fairy tale. We could see issues bonding with baby. We see postpartum depression and postpartum anxiety. We see something that's called maternal ambivalence, and that is something that's very normal, but a lot of moms struggle with and think it's abnormal. And it's that feeling that when you're a mom, you love your babies, but you don't necessarily love your new life, and you miss your old life. And that creates a lot of turmoil in us, because going back to the realities of motherhood, we probably heard a story growing up that motherhood is the best thing in the world. It's amazing. It completes us and nothing else. We're not going to want anything else once we become mothers. But that is completely untrue. A lot of moms have irritability and rage, which often come as a package deal with postpartum depression, postpartum anxiety. There's numbness and disassociation as a way to deal with all of these feelings. They're very difficult. You might feel trapped by motherhood because your life might have completely changed. And even if you prepared for it, you can't ever truly prepare for it. And another common one is you might have a lot of anger at your partner. Again, because it doesn't look like their life changed that much, but yours did. Dr. Ksenia, do you have anything else to add to this?
Yes, on the next slide, as we're going to talk about the postpartum depletion syndrome, I think it really comes hand to hand with it together. And these are all signs and symptoms that a lot of moms, the ones that you went over, don't really recognize, or they kind of like start to try to push away. And in addition, they'll feel wired and tired. They'll have brain fog. Some of this actually starts in the pregnancy versus postpartum. It's like kind of coming on in the third trimester and nobody's catching it. And then it really hits hard in the postpartum. So it'd be nice to really prevent that from happening. You get overwhelmed, like there's no time for me, no time for self-care. You lose self-esteem. You kind of want to be isolated and at home, like not going anywhere, just in bed, and not wanting to see friends or family or anybody. So this kind of it ties in together with postpartum depletion syndrome, because I believe that truly we get depleted as moms. Babies will take whatever babies want during pregnancy. And then you throw in postpartum where you're breastfeeding and just they're sucking out all of our nutrients, right? And we're forgetting to replenish. And that's where that nutritional aspect comes in as well.
Yeah, absolutely. It is hard being a mom. I think we would both know, being moms twice, and I want to say, at least for me, each postpartum period hit differently. What about you, Dr. Ksenia?
Different babies, different pregnancies, different postpartums. I always preach that it's never the same thing.
Yeah, absolutely. I felt that. So continuing on why a lot of this happens, we lack support and community in the way we live our lives now. We don't necessarily have, parents, siblings, or other family members nearby. We're not exactly in the community where we're surrounded by other women raising children. We have usually one of two scenarios. You either have a mom who's working at a job outside of the house, and then she is then coming home taking care of her kids. And as Dr. Ksenia said, there's no time for self-care or for anything else. Or you have a mom who's a stay-at-home mom, and she's raising the children pretty much by herself because her partner is probably out working out of the house, and she's isolated within four walls. And a lot of us being brought up in the culture in the US, at least, which is where we're located, is we believe that these are the only two ways to raise children, where in reality, this is not biologically appropriate for us at all. We should be raising our children in the community, around other women, around other children, definitely not isolated within four walls. But when you do end up being within four walls for a long period of time, this is when you have feelings of resentment and loneliness, overwhelm, and that can become something bigger. You could develop full-blown depression and anxiety. And it is a difficult thing to get through. But unfortunately, as I was saying before, 20% of women in the US do struggle with postpartum depression, postpartum anxiety.
We are definitely missing our village.
Yes, there is no village for most of us. It's hard. Even when we have grandparents around, sometimes they're either too old to help us or they're still working. So, even if they're nearby, the village is not available for us. So while we can't replace the village for you, we can support you in your motherhood journey. And that is part of the reason why we wanted to create this presentation, because we wanted to give you some tools that you can use in the absence of a village, because just because we don't have a village does not mean we can't support ourselves. And that is why we're bringing this integrative approach to you to help you improve your postpartum period. All right, so as I said, I'm a transformational EFT coach, and EFT tapping is one of the main modalities that I use to help my moms help with their mental health postpartum. If you've never heard of EFT, it is a form of somatic therapy, because what we're doing is we're engaging the body with the understanding that our thoughts, emotions, and sensations are all interconnected and affect each other, and we can affect our emotional state through affecting our body. EFT is very simple in the sense that it works on the points in our autonomic nervous system, or if you've been to an acupuncturist, it works on the meridians, and the meridians are essentially our autonomic nervous system. We use those points, we tap on them with just our fingertips, so there's no pain, no needles, nothing. You can do it anywhere. It's fairly easy to learn. So it could be a great self-help technique as well as a deep healing tool. And so what I wanted to do is, so hold on. So a little bit more of EFT and how it's helping us support our maternal mental health. So it helps us get to the root of the problem. A lot of our problems are emotional, even if they manifest physically. We do have a lot of research showing us that our traumas do manifest physically, and you never had to necessarily had like one big trauma for it to register in your body. A lot of little ones register, sit in their body. And with EFT, we go in, we identify what the root cause is, we tap on it, and then we try to bring in some cognitive reprogramming so that we can help your brain to feel that it can be safe. It is safe to heal. It is safe to let go of all this overwhelm. And there's a lot of overwhelm in the postpartum period. And so what we can do today is do a little bit of a tapping session together. Dr. Ksenia, you ready to be
I'm
my
excited.
partner in this?
Yeah.
Okay. So EFT is very simple, and I'll show you the points first so that we know, and you can follow it. So it's most of our points are going to be located around our head and the upper area. So what we're going to start off in what's called the karate chop, and we will be tapping here. We'll be saying the phrase, and I'll just go through the points before we go. Then we're going to go to top of the head, and it's just the crown of the head with as many fingers as you'd like. Then you go into your eyebrow points and you tap here while saying the phrase. You go tap on your side of the eye. You go under the eye. You go under the nose. You go in this under the lip point. You go on the knobby parts of your collarbone. You go under the arm, which is for you mamas going to be your bra strap if you're wearing one. That's an easy place to find it. And then we're going to repeat this one more time, where we're going to go back to the karate chop. I'm going to go top of the head. We're going to go eyebrows. I'm going to go side of the eye, under the nose, under the lips, collarbone, and finish up under the arm. And I wrote it out on the slide so that if you, for some reason, want to repeat this again at home, you have the wording that we're going to be using. So this is what we're going to do. We're going to sit comfortably, take a nice deep breath, and prepare. So we're going to start tapping on the karate chop on either one of the hands. And we're going to say, even though I'm feeling overwhelmed right now, I love, accept, and forgive myself. Even though I feel like I'm drowning and can't keep up with life, I love, accept, and forgive myself. Even though I feel like I'm not a good mother, I love, accept, and forgive myself. Let's go to the top of the head and say, I'm feeling overwhelmed right now. Eyebrows. I'm drowning in motherhood. Side of the eye. I'm not meant to be a mother. Under the eye, I am failing. Under the nose, there's just too much in my plate and I can't keep up. In your chin point, I am so overwhelmed. Collarbone, I am so exhausted. Under the arm, I can't handle everything that gets thrown at me. Yeah. Next one. I acknowledge my overwhelm and exhaustion. Top of the head. And I'm allowing myself to feel them fully and completely. Eyebrows. And I'm allowing my body to grieve. Side of the eye. I grieve my old life and my freedoms. Under the eye. It is a difficult time in my life, and that is okay. Under the nose. I don't have to be strong, and I don't have to be perfect. Chin point. I can just be myself. Collarbone. I am allowing myself to experience all that I'm experiencing. Under the arm. And I'm allowing myself to simply be an exhausted mother who needs time to rest and relax, and who also deserves to be taken care of. All right, and then we can stop tapping, take a nice deep breath. and really feel it in our body. And this was just a very simple, short tapping round. You can repeat it on yourself whenever you want to. If you feel anything after this, that's great. You might have yawned a little bit. You feel refreshed. Good. Yeah, you can feel refreshed. You can feel lighter. You might be yawning or sighing. You might feel some energy kind of moving throughout your body. And those are all good signs, because that is what we want to accomplish. We want to integrate your body into this healing. And that is how we can actually let go of a lot of these feelings of this overwhelm, because being a mom is overwhelming. Being a mom in the 4th trimester is incredibly overwhelming. All right, and now we're off to talking about some of the more physical things that are happening in your body.
So how we're talking about overwhelm and really like having those tools and resources through EFT, we also need to understand what is happening with our body on the inside so we can address it. And adrenal fatigue is real. There are 4 stages of it. So adrenals are located on the top of your kidneys. They're kind of like pea-sized organs, but they really matter. And when they're in high stress mode, because your adrenals are responsible for cortisol, when they're in high stress mode, they're really going to take over and affect your whole endocrine system. Your thyroid is going to get affected. Everything's going to be not in balance. So stage 1 is usually people don't really recognize it. Stage 2 are my coffee drinkers. So if you're pulling for a coffee all day long, that's stage 2. And usually you'll get like basically little like afternoon crashes where you really want sugar at like the 3 o'clock hour. I remember when I worked at UCSF doing research, we used to have cookie and happy hour. And the reason for that was they wanted to feed everybody sugar, so then we had more energy to finish off the day. But that's why it was at that 3 p.m. mark. And that's when people usually crash during the day. Stage 3 and 4 are really hard to fix just easily. It takes about a year or 2 to really get out of that burnout phase. And that's usually you're having like signs and symptoms of like, I don't want to go anywhere. I'm just tired. I just want to stay in bed. You can have like a nice long 8 hours of sleep, but still wake up not feeling refreshed and exhausted. And so with adrenal fatigue, what we want to do is like nourish our body from the inside out. And I think mindset is one of them, of course, and with the tapping. But the other side of it is the nutritional component. So foundational mama support. I cannot tell you how many times I ask my moms in practice when they're in postpartum, are you still taking your prenatals? And the answer is always no, I'm not. I'm not taking anything. It's like we built this beautiful baby and all we want to do is do all the work for baby during pregnancy, and then postpartum, we're like, who cares about us? We're just going to concentrate on baby. And that's not the right way, because moms, you are the foundation of the family. And if you don't take care of you, everything is just going to go downhill. It's just kind of like building a building, right? Or a house. You have to lay out that solid foundation. And if you don't, everything crashes. So mama has to have her vitamins, and these are the main ones. So I personalize everything, but these are like the main ones that we really need to address and have. You can still take prenatals during the postpartum period. I know a lot of companies have started out and doing like postpartum supplements. Those are fine too. Making sure you're finding supplements that have good quality is really important as well. They don't have chemicals, synthetics, always check for that. Vitamin D3, choline, those are all important. I really like the company's orthomolecular for vitamin D3. Choline, I really love Body Bio PC. And choline, they have found that is the sister to folate. So hopefully you're taking additional choline from pregnancy to postpartum to help support the extra needs. It's also found in eggs. So if you do eat eggs, that's, eat eggs daily, it is found in there. Zinc is great because our immune system is lower during pregnancy. So zinc for postpartum and pregnancy, vitamin C. Turmeric helps with inflammation. So a lot of the times they have a lot of hormones flooding our system during postpartum. So turmeric is going to help decrease that inflammation, a lot of like swelling in the arms, especially moms not able to hold their babies. So turmeric is going to bring down, you can cook with turmeric, you can take turmeric, and then omegas, which are anti-inflammatory as well, are really important. So when we think about postpartum, we want to think about how are we setting our success up for breastfeeding, or bottle feeding? How are we really setting boundaries in our relationships? Thinking about if you were anemic during pregnancy, are you anemic still? Making sure you're still taking your supplements like iron, nourishing teas like nettles is really wonderful during postpartum. Red raspberry leaf tea is recommended during pregnancy, but also postpartum. So a lot of the times we forget that it's okay to take that as well. We're dealing with things like constipation. So making sure you're drinking great smoothies with like lots of fiber, like a good protein, good greens in there, and nourishing your body and hydrating it. You want to be at least drinking half your body weight, but for postpartum, especially if you're breastfeeding, I always say it increases, definitely increase that. And blood work. Blood work is huge because postpartum, a lot of the times it gets so much blood work during pregnancy, but postpartum, we forget to do blood work. So making sure that you retest your blood and see how everything is doing during postpartum, at least 4 weeks out. There's also non-invasive ways. I have lots of different labs that I use, but remedy testing is one of my favorites because it's easy. We just test the saliva and send it out. And on the corner of the slide, you can see different circles. And those are actually really cool because they're showing how organs are working. So organs are really important, right? Like the liver, how everything is working in the postpartum stage. So it's really nice. It gives you also info about your hormones, any food sensitivities that you may have developed, because going over autoimmune issues spark up during the postpartum period a lot of the times because our body changes, things happen. So it's really good to have the blood work, the remedy testing done to see how you can nourish yourself from the inside out. This is a great Nourishing Mama tea blend. Like I said, nettles is my favorite, and raspberry leaf. I love to make sure that I'm steeping everything instead of using packets because it draws out more vitamins and minerals for you. So like nettles tea has a lot of B vitamins, iron in it. So it's a great source for postpartum healing. So this is a great recipe. I get my herbs from mountainroseherbs.com. I get them like in big packages because you can use it forever. And steeping this overnight and drinking it can really help make sure we're drawing out those nutrients. You can add honey to it if you don't like the taste of it, but I think it's delicious without it.
I love Mountain Rose Herbs. Such a great website, such a great company.
Going along the mindset, just like Maria went over EFT, I think affirmations are great too. I think having that, we use affirmations for pregnancy, for birth. Why don't we use affirmations for postpartum? And just realizing that you are a great mom, and like even having somebody tell you those affirmations, or you just seeing it on the mirror in the bathroom, like waking up and seeing that, I think is going to really affect and take you to a better level, feeling just really good about yourself. And, that little reminder, you are a great mom, and it's okay to nourish yourself and not just the baby. It's okay to drink water, the simple things that we forget, or like to eat lunch or something like that. Cause I have a lot of moms that say, I won't eat lunch, or I'll skip breakfast. And I'm like, how are you still breastfeeding? You're lacking all the nutrients, so making sure that that being a mom and the postpartum, when we talk about postpartum stage, it's not just the first 3 months. This can last for a long, long time. the depletion. So making sure you have this not only for the first year, but for life in general. And I think EFT too, like those are easy resources and tools that you can carry along, not just postpartum, strictly 3 months after you have baby, but for a very long time.
Yeah, and in terms of EFT, you can take all these wonderful affirmations that Dr. Ksenia came up with, and you can use them while tapping. So while we changed something on every point. You could take just one affirmation and just go through the same points we went through and tap and say, I am worth nurturing, and tap it every single time. Tap it into your body so that your body believes it and your system registers it. So that's a great way to combine the affirmations and EFT. So yeah, mindset work, it is important. So we have come to the end of our presentation, and we thank you so much for joining us today. And I wanted to share something that is the motto of my company. And I know Dr. Ksenia will probably agree, given that she focuses on moms too, is that Mama, you are the heart and the soul of your family. The heart and soul needs to be tended to in order for the family to thrive. And I think that needs to be remembered, kind of like what Dr. Ksenia said, that she has clients who don't eat breakfast, don't eat lunch or dinner. This is what happens to a lot of us. We start putting baby first and we don't take care of ourselves. But this is really a situation where your oxygen mask needs to come on first before your child. Because if you want to give your child the best, you need to be at your healthiest and your best for yourself. And then your child is receiving the best of you. So remember that you are very important and you do need to take care of yourself. So here's some resources and contacts. If you want to see what I'm up to, what I'm doing, you want to schedule a connection call to talk about whether EFT might be the right way for you to help with your postpartum depression and anxiety, you can go to my website. And you can also find me on Instagram and TikTok and Facebook, and you're welcome to email me as well.
I love all the resources. I think it's so important. These are my resources, my website, where you can learn a little bit more about what I do. I have the Pregnancy University, which is a full academy of classes, virtual for moms. And I also have an Instagram where you can follow me for some tips. If you want to email me and connect there or text, I'm always happy to say hi and kind of guide you and give you some more resources as necessary.
Yeah, and so here are these wonderful special offers that you can scan the QR code and you can connect to us.
Yes, made very simple and easy, some QR codes with our little offers. My Mindful Mama Academy is hitting off starting January 2023, where I'm producing a supportive community for moms to be able to know what herbs to take, what prenatals, what vitamins, but also stretches and exercises. I think a combination of that is really going to help moms thrive.
Yeah, and if you click on my offer, you're going to get to my packages and pricing, get to find out more about what I do in my one-on-one coaching, as I do provide 2 different programs and support. So I would love to hear from you and would love to help you with your postpartum journey. And again, we thank you so much for joining us and listening to this presentation. And I hope that all the moms that listen will start thinking about themselves and will start thinking about taking care of themselves in order to thrive. Because you thrive, your baby thrives, your children thrive. It's a win-win.
Fill yourself up with so many resources to help you. And we're here for you. We really appreciate you spending your time with us today.
Thank you.